Welcome everyone, hi, my name is Chan, one of the junior doctor working in NHS Highlands. In today's video presentation, we will be discussing about surgical diathermy as a common topic in the MRCS exam, so let's get right into it. Again, we will be discussing the definition, the different types, modes, and functions of a diathermy, and how we can best utilize this tool in the operating theatre. We will also touch base with regards of complication, as well as when to and not to use an diathermy as we go along. So, what is actually a diathermy? Before we move on any further, it is good to first understand that it is the ultimate responsible of the operating surgeon. It functions by using high-frequency alternating current radio wave to produce a local heating effect which can be served to destruct the tissues, to seal the blood vessels, and also to stop the bleeding. Depends on the different modes that we use. Once again, before we proceed to the different types of diathermy, whether it be a monopolar or a bipolar, it is essential that we grasp the concept of how diathermy is used using human tissue or part of our body to complete an electrical circuit. In the case of monopolar diathermy, there is a presence of a generator, a diathermy electrode, patient's body, and the diathermy plate to complete one circuit. The tip of the electrode, as shown in the right hand corner of the diagram, has the highest current density for heat generation. Besides, the bigger the sizing of the diathermy, the bigger the potential to maximize the electrical conduction energy away from the patient. A good placement of a diathermy plate is the key to prevent adverse event when using the monopolar diathermy device. It should ideally be placed near to the operative site, away from any metallic prosthetic implants such as a hip or a knee joint replacement. Also, aiming for a region that has well vascularization and big surface area such as the thigh. The plating area should be shaved to improve conduction efficiency in the case of a very hairy skin surface, to ensure the good contact between the pad and the skin. This can help to prevent any fluid seepage which can potentially cause a full thickness skin burn. The key difference in bipolar diathermy are the presence of two diathermy electrodes instead of one, and the absence of a diathermy plate. Hence, this is often a preferred diathermy of choice in patients with implants. Now, let us to move on to look at the different diathermy modes, such as the cutting, coagulation, and lastly, blending mode, which is the combination of both. As we can observe in this diagram, incision, aka cutting, and coagulation are the two main modes. But I would just like to point the attention and focus on fulguration and desiccation, and what do they actually mean. Fulguration is the destruction of the superficial tissue without destroying the deep-seated tissues, as can be seen in this illustration, whereas desiccation is a state of extreme dryness by definition, and the tissue changes are due to the drying and the limited coagulation. Now, again, let us take a step back to the cutting mode that we have mentioned. And before we move on even further, I would just like to point out the VIP formula as shown underneath the diagram. So V stands for voltage, I stands for current, and P stands for power. You will then realize the importance of this diagram when I come to each explanation of different modes of diathermy. So in cutting mode, first of all, it is a continuous waveform with low voltage, high power, cell water vaporization, and the focused heat distribution, which can result in tissue destruction. On the other hand, coagulation mode is a pulsed waveform, high voltage, lower average power, and it achieves coagulation by charring the surrounding tissue with a wider distribution of heat. And lastly is the blend mode, which, like I've mentioned, is the combination of both, though these are not widely used. I put up a graph of summary of different modes as explained previously. So to help us remember this, just bear in mind that cutting is continuous and requires high power, while coagulation is in a pulsed waveform and requires lower average power, but with higher peak voltage compared to cutting mode, as can be seen in this summary diagram. So we have just finished exploring the basic principles of a diathermy and how they function. Hence now it is the time for us to look at the potential complications of diathermy, and these are the reasons why we should always use this device with great caution. So, as this is a device that generates heat and electricity, so burns and thermal injury are the two main concerns. And these can be resulted by the inappropriate diathermy plate placement as well as the poor diathermy technique. Now let us to focus on the incidence of direct coupling and what does it actually mean. So direct coupling is the case of laparoscopic surgery where there is an accidental contact between the diathermy electrode and the laparoscope, causing accidental burns to the surrounding viscera, such as the bowel walls, as shown in this diagram. Then there is also a risk of fire and explosion when there is aerosolized alcohol, such as diethyl ether and cyclopropane, that can make contact with the electrode to produce fire. Lastly, the smoke generated from the diathermy can potentially be carcinogenic as well. Lastly, when is the time that we should not use a diathermy during the surgery? The one example would be where there is a presence of an implant such as an ICD device, which can cause a failure when it is not deactivated prior to the surgery. And this is the reason why there is the availability of external placing be available in case of cardiac dysfunction. And that's the end of this video presentation, and thank you very much for listening, and see you next time.